Hello everyone. Today we will discuss the topic Bhore Committee. It is an important topic in community health. So, Bhore Committee was started in the year of 1943. In the year of 1943, that time the condition of health in India is very poor. So that time the death rate, or we say the mortality rate of infant as well as pregnant women or the disease persons is very high, and also the incidence of the communicable diseases that time also very high. So there will be proper planning will be need for the control of this death rate. So in the Bhore Committee, or the William Joseph Bhore, he started this committee in the year of 1943. So Bhore Committee was appointed in the year of 1943 with Sir Joseph Bhore as his chairman. So in this committee, so number is the chairman is the Bhore, William Joseph Bhore, and some of the experts, otherwise some of the committee member, that is about 24 persons are there, and they are also experts in public health, medicines, and sanitation department. So they plan, and they are also followed. Their work also be followed by the foreign advisor. So by their hard work on this committee, so they plan for a better development of the health services. Then this board committee is also named as, the official name of this committee was Health Survey and Development Committee. So this is the committee also known as the Health Survey and the Development Committee. So the first, there is survey should be there, and after getting the result or after getting the informations for the better planning, or the how the health services will be developed, how the health services will be improved, so that will be planned. So to survey the existing positions regarding the health conditions in the organization, first we have to survey, and second to make a recommendation for the future development. So after survey, what we get the informations, then we plan for a better or improved health services for the future development. So they after his 2 years of work, he submit his report in the year of 1946. So as the Bhore Committee was started in the 1943, but the Bhore is submitted report in the year of 1946. So it will be known as Bhore Committee in the year of 1946. So first time he was proposed for a national health program. So nowadays we see number of health programs are going on the basis of communicable diseases, nutritional programs, and many more. So this for the first time this committee has suggested or proposed for the health programs that will be need for the better health services, and this for improving the health. So after his 3 years of hard work, what the committee observed? So the observation of this committee is that if the nation has to be built, suppose we want to develop our country, so we have to first strengthen our health condition of our people. So if the nation has to be built, a health program should be developed on the foundation of the preventive health, and the health services should be which steps? One is the preventive, and their preventive activities should be proceed, and this preventive activities should be proceed side by side with concerned treatment of the patients. We are providing both. If we provide the preventive services and side by side the curative services, or the proper treatment of the patients, then the foundation will be the foundation of the health will be improved. And if the health standards of the country is increases, that ultimately help the development of that country only. That is observed by the committee. This is the observation of this committee. So after everything is clear, surveys is done, and observation we get in the year of 1946. So the Bhore Committee planned for some recommendations. So he is given important recommendation in health. So first one is the integration of the preventive and the curative health services in all levels, in primary, secondary and tertiary level. So the health services should be like preventive way as well as in the curative services. So that is the integrations of the preventive and the curative health services in all levels. And second recommendation, the development of the primary health center. So the PAC is playing the major role in health, because the PAC is the first health organization where the people directly meet to the medical officials. How? So the development should be need in the PAC level. So they again in PAC in second recommendation, there is a short-term plan is there and a long-term plan is will be there. In short-term plan, we see the primary in short-term plan, the one primary health center will be established in 40,000 of populations. Okay, and the secondary health center, now we are calling it as community health center, CSC, that will be served as the supervisory, coordinating and referral institutions. So whatever the case that is not solved in the primary health center, that will be referred to the secondary health centers or CHC. In left we see in the long term plan. So long term plan is also known as 3 million plans. So under this planning, what is there? So the one primary unit, there is a three tier of unit. So the primary unit or the PSC, that will be strength about 75 bedded hospital. So in primary health center, there will be the strength of that hospital will be 75 bedded hospitals, and for 10,000 to 20,000 population, and it is served by the 6 medical officers. They are from the Department of Medicines, Surgery, Obstetric and Gynecology, and they are supported by 6 primary public health nurse and 2 sanitary inspectors. So after in this primary unit, there should be adequate ambulance should be there, adequate ambulance should be better, adequate ambulatory services should be there, so that the case that was not managed in the primary unit, that will be referred to the secondary unit. And so in secondary unit, the strength of the bed is 650 bedded hospitals. The strength will be increases 650 bedded hospitals, and that is under a secondary unit, that is a 60 primary units are there, and the secondary is also known as first level of referral hospitals, and next to it, that is the district or the third tertiary level. You see, you call it 3 tier or the tertiary level of hospital, and that strength of the bed is 250 100 bedded hospitals. Okay, and in the district hospital should be attached to the medical colleges. So third recommendation is the major change in medical education. So first time Bhore Committee proposed for the medical education. So in medical education, by which we can get the more experts in the public, more expert in the expert health, active health professionals by undergoing a training program. So he first proposed for the 3 months of training program in preventive and social medicine. Those were named as social physicians, and that will be that is a major change in medical education. And the first time the Bhore Committee also planned for the MBBS educations. And this Bhore Committee also want a centralized institute should be there, propose a centralized institute should be there. So the proposal of aims that will be started given by this Bhore Committee. So this is all about the Bhore Committee. So important point is that it's the important point that when the Bhore Committee was started, and when in which year it's given the submitted report, and it's official, what is the official name of the Bhore Committee, and what are the recommendations, what are the recommendations that will be recommendation in the Bhore Committee. So these are the important points, and that will be come in the questions, and this is all about the healthcare, all about the Bhore Committee. Hope you understand. Hope you understand from this video about the health situation in that time, and how the major changes that will be suggested by this Bhore Committee. So thank you for watching, and please subscribe my channel.